views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello and welcome back to Open 2.0. I am host Alyssa Colon. I hope you all staying safe and healthy. Open 2.0 wants to acknowledge and thank all the organizers, protesters, youth, and communities fighting for social justice. Thank you, we support you, and we are in community with you. Today we are joined by Dr. Nunez, a Bronx-based bilingual pediatrics physician. Dr. Nunez will give us some updates and important information on current crisis and how youth are being affected. She gives families some advice and tips and tells us about new youth health shows coming up to BronxNet. Thank you for joining us. Now, my first question is, can you talk to us about being a pediatric doctor, director, and what that entails, and how working with Bronx families and communities is so important to you?
I felt the need that because I'm Hispanic, I was in a Hispanic community, that not only serving the hospital, but that I could serve my community, going in the community and become and be surrounded by the people here, right? Us. So I decided to go in and open a private practice, very small. Started in 2010-11. And then slowly it went growing, and now we serve over 10,000 families in that clinic. And a couple years ago, we started seeing a lot of issues with our children, with our youth, and especially in the education part. One of the studies that we did. Together with my daughter, actually, we did a study in the foundation. We did a study at that time where we found out that only 25% of the kids were graduating from high school, and 18% were going into college. So that was we were so worried about that. I didn't understand. So we started looking into what could we do to help the community. What could we, and in which way could we help? So we started our same clinic in the basement and started recruiting youth from our clinic and asking them if they needed any help and just to see what the needs were. We created a small pilot program, and there we took 40 youth and we were able to help them throughout the year, but only 12 of them were able to get into college. So we were also, we decided to kind of like go deeper into it and see what happened. Why couldn't we, what were the issues that we were finding? And the issues that we found was that once our parents, don't know English, don't know the language, most of them don't know how to read and write. So they don't know how the system works. And so we decided to target that part of the community. So we created English as a second language for adults here. And we give classes, before the COVID classes, English classes for free to our parents. Then we went to the spectrum we went to the other side, which were the youth, the high schoolers, and there we decided to create a program in Spanish, Latinos Destinados a Triunfar, where we help kids with the process, the college process, kind of guiding them with the grants and things like that. But we're still missing a part of, if we don't catch these kids kind of in an earlier phase, we will not be able to help them with their credits, with the community service that they need, and just other things that they needed. That's why they couldn't get into college. So we targeted our actually younger kids from second graders to eighth graders, and we created the Caterpillar Homework Club, where we help the families. We're kind of the liaison between the families and the school. There we help the kids with their homeworks. So we're not tutoring. we're sort of mentoring them, helping them with their homeworks, and we were able to get some, because we were completely self-funded, we were able to get volunteers from the colleges, and they would come here and help our kids do their homeworks. And then once a month, they would meet with the parents and meet with the teacher over the phone and have that conference in Spanish and their languages and help the parents understand what's going on with their kids. We also focus a lot on kids that have learning disability, kids with autism. So we kind of focus more on that spectrum. So we ask, that's what we do here in the foundation. We've been already up and running for about 2.5 years. Now we sort of modified a little bit with everything that's going on, but we're still having the program. It's just a little bit different. And the other thing that I was able to accomplish or wanted to do was to help the families that didn't have insurances, that didn't know what's going on, Latino parents. And what we did is that we opened an urgent care also nearby where we have the foundation and the clinic, to have the parents go there if they needed any health care, or somebody that would speak their language so they can communicate with them, because that's one of the biggest issues that we have here right now. Parents don't like, or adults don't like to go to the hospital. They can't communicate, they can't get through. Phone calls are terrible, so at least that's a place where they can go. So so that is what I do in the community. That's what we've been doing. Trying to help our community with health education, and we also we give free meals that's supported thankfully by Somos Community Care and Dr. Talaj, under the leadership of Dr. Talaj, who helps us give food for the community. So yes, that's what I do.
Thank you so much. That's beautiful and everything that what you're doing. And now for my next question, we are now in June and COVID-19 is still affecting all of us globally. How has COVID-19 been affecting youth more since February? What are some things you notice or patterns that exist in youth COVID cases?
What I was seeing in the clinic with my patients, same at the foundation, and I would say my patients, because they're all around in our clinics and our foundation, is that the youth were stressed out so much for different reasons. One's, it's a new way of living right now. We're all in a house. We're kind of confined in the space. We were used to being outside, especially youth, right? They're doing sports in school. That's one of the biggest things that I really, really work on with my kids. I did it, and with all the kids that I see in the foundation and the clinic. I talked to parents, and I always spoke to them about making sure their kids were busy. Busy doing activities, busy doing baseball, doing any sport, swimming. Even though very hard here in the Bronx, by the way, very, very hard to get things like that here for our kids, but still I would speak to them so they would understand that we needed to keep our kids active. Their brains these are different times compared to others, right? The social media aspect is completely different compared to our time, compared to my time, compared to when I raised my kids, right? So now we're seeing that we're telling them, and it's not telling them, we're mandating, right? Not us, but the state. So it's not only their parents, but it's kind of the state, the Department of Health mandating everybody to stay home. So that is just by itself, it's complete change of mindset. It's easier for us, we're adults, we're used to having stress, we're used to dealing with issues and looking at the positive side. A lot of people don't, they look at the negative side also. But we're, as adults, with time, have grown up, right? So we learned how to deal with stress and learn how to deal with different type of people. I learned how to deal with different personalities everywhere I'm at, right? But youth is a little bit different. They're literally just learning now what life is, right? This has been thrown to them. So when I meet with my youth, we do that once a week, and we talk, and I just let them vent. They want to be out. They're stressed out. Some are depressed. Their anxiety level is up the roof, and because they're uncertain of the uncertain. So because we don't know what's going on, right? The doctors don't know. We were not expecting any of this to happen. It's not the same when they tell you have diabetes and you need to get insulin and you need to do it 3 times a day, you need to measure and count your calories, they're going to say the youth is, our 14, 15-year-olds, right, with pre-diabetic or diabetic, they're going to be, stressed out at the beginning. But when you show them the facts, it's easier because they'll get it. They won't get it right away, but they will get it. They'll get that they need to have certain amount of insulin because so it's something that they can read, they can understand. But now it's different. Now we're in times that we don't know what's happening. It's all over the news. We're talking about it every single day. You turn on from the morning up to the nighttime. You turn the TV on, and the only thing that people hear is, stressful news in TV from the beginning, from the morning to the nighttime. And they're in class, now they're also adding to all this. They're not in school with their friends where they can vent and, and talk about what happened at home or happened with their dad. Now you have their parents there kind of 24/7. So mentally, I think we're, and I've said it several times already, we are now, it's coming. We haven't seen it. I've started seeing it already. It's a new pandemia, right? So it's a mental health one now for our youth. Now we need to be very, very careful, pediatricians, doctors, family members, and look at our youth and just make sure that we're able to help them out, that they're able to talk, that they're able to vent. Because the mental health part that's happening, and it's going to keep on happening, and it will continue because this is not stopping, is really, really big. It's real. And we have to be prepared for that. So that's in the mental health part. And the clinical part, I've seen it, I wouldn't say all, but I've seen the kids, get very, very sick. And a lot of youth that just, that just don't get sick, didn't even realize they have the disease. So I can either go, talk about the clinical part, can talk the mental health part, but I think in my view, what I'm seeing now, what I'm waiting or expecting or getting prepared for is sort of that behavioral issues, mental health, like how can we help our youth surpass everything that's happening right now, because it's uncertain and it's just it's very stressful for them.
So we have seen some outdoor and group activities have resumed, like youth baseball and other sports. Why do you think that this was given a green light?
So we already, I think the youth already, this youth compared to before, it has already different mentality, different mindset with the social media, creating this kind of loneliness, this kind of just thinking about themselves, just in a fantasy world, right? So we have a lot of social media now, and you see so many things going on, and you can spend hours and hours on a phone, even yourself, if you don't realize it, right? Like I literally all day am looking at my phone for different things. It's a computer, right? The phone is a computer. So for you to create, develop personality, you need to have different, you need to be exposed to different things, right? So if our youth, on top of that, is getting a lot of stress thrown at them because now they're home and everything they turn on is literally saying hospitalizations, 500, 2,000 deaths, 2 million people. It's like it's every single day you get the same everywhere, right? And same information. So imagine that. What's going to happen to our kids? What are we gonna see later on? So I'm assuming that the thought is that they need to interact with other kids. And they need to be active, right? You cannot have, the obesity part, right? We already are a community that's high in obesity, high in diabetes, and high in asthma, right? So you're keeping these kids home, they're going to become more obese, they're going to become more, more diabetics are going to come up now. So it's kind of like, what should we do? It's a fine line, and we don't know. Do we take the risk and see what happens, right? And we're also in the summertime, so we do have some data saying that the virus will kind of minimize its infectivity now in this time. So they're sort of getting, I guess, some sort of advantage of that. We have to be prepared for the second or third wave that will come um, in the cooler months, so September, October. So let's take a little bit of advantage now that the weather is getting warmer now, so the kids can go out and can just be kids. Youth can do activities that they need to do to become kids. Um, so that is the reasoning behind that.
How should youth protect themselves and others while interacting in outdoors and/or group activities?
We have to live like this for now, right? Until all this will pass, because it will pass. It's like the flu came and now it passed, right? It still comes, but we know how to protect ourselves. So right now, I know it's very hard, but we all saw what happened. And we all saw the surge, we all saw the deaths and all that. The youth should protect themselves and wear their masks. They have to make sure, even though they're playing sports, to just keep as much distance as they can from each other. I know they want to talk. You can talk. Just make sure you have that 6 feet apart or a little bit more apart, and just talk to each other. You can be in a circle, and just if you're in a park, just go in a circle and just everybody talk to each other. So they have to keep their mindset that they have to make sure that they have their masks on and that they keep distance apart. The hand hygiene, very difficult to do outside, right? You're not going to do it. So what's the most important thing? Just don't touch your face, right? Don't touch your face, don't touch your mouth, don't touch your nose. Kind of learn how to talk. Like I talk a lot with my hands, and I just, hold my hands with, one with each other a lot, put it down. But I do more of this because if I put it down, then I'll go to my face. So kind of just learn how to touch your hands or use your cell phone and just, hold something so you don't touch your face and your eyes. So those are the most important things. Yes, have hand sanitizer with you, but you know what? You're going to be outside. You're going to be touching things. So I think the most important thing, besides washing your hands, if you can, and putting hand sanitizers, the most important thing is make sure you have your gloves on and your masks on. Make sure you keep the distance and just don't touch your face. You will touch, you have to open the doors, you have to, you're going to play your sport, you're going to use your basketball. Can you use gloves? Absolutely, you can use the gloves. Make sure you dispose them. Make sure you don't touch the ball and then touch your face. So that's why I say it doesn't matter. You have gloves, you wash your hands, you put your gel, just do not touch your face. Minimize the touching of your face or your hair, right? Try to use something to cover your hair a little bit. I was working just now seeing patients and I literally cover my hair. So I don't have to think about it. And so I cover my hair, nothing touches my hair. And I don't have to, I don't have to worry about getting something close to my face. So I think those very simple, but as you can see, it worked. The numbers went down when everybody was isolated, when everybody was taking care of themselves, when we were distanced. So it does work. It proves it works. So we should just keep it.
It's great that we're talking with you today and getting important information. Can you tell us about your youth podcast and work with youth?
It's kind of a virtual part of what we used to do before the COVID, which is Bronx Leaders of the Future. And it's a group of teenagers from seniors, sophomores, juniors, freshmen that get together once a week. And we virtually now, via Zoom, we virtually all meet. And I literally just am support. Right now, I'm just a supporter. I'm kind of that person that they know me. I'm their pediatrician, and they know I'm a great listener. I love teenagers. I had two. Now they're older. I miss that part. I don't miss the trouble that they bring. Not the trouble. It's just a different way of is that they have different mentalities. So sometimes it's not an easy thing to do. But because I lived it as a mom, and they had they had their personalities, and trying to understand them is so hard. I tried to apply everything I learned with them, and it was not easy, trying to be their friends, trying to listen to them. But they had so many friends that would talk about different things that they thought, they were so like, why are you talking about like that about your mom? My mom is not like that. My daughter would say would ask me to come and, be with their friends because they wouldn't believe that I would talk to my daughter about birth control or a condom when she was like 14, 15, you know. And I just always kept on doing that. It's like, here, just in case. And she would be like, oh, like, oh my God, why are you saying that? Like, you're not even supposed to say that to me. And she's like, Mommy, do you think I have? I'm like, no, it's just in case. You know, so her friends would be like, oh, I should have that mom, you know? So I had a lot of fun with my kids when they were younger. It wasn't an easy thing to do, to take care of them in this day and age of where, you know, where social media is such a big thing, right? Having to tell them to stop using the phone when we were eating, it was like, why? Like, you're not supposed to do that. Or why do we need to eat on the table? I'm like, because that's my culture. That's our culture. We're Latinos. We eat all together. And it was just, they would always find an excuse, right? So you know, just living that with both of my kids, I found a passion for teenagers, and I've had a lot of teenagers that are, like, I have been using, let's say, drugs, right? There's one in specific that I always love that story. She came very young, and parents stopped coming to the clinic. And one day, she just stopped coming to the clinic. So she would come on her own, 11 years old, 11 and a half. So, you know, we talked a lot about drugs, and she would, you know, confess that she was doing weed. So, you know, I said, let's just try to work out. And I would work with her, would bring her in every Saturday just to talk to me and see, you know, I would do like little trials of, okay, let's do it. I would do like a 2 week without using weed, and I would have her come in, and she would, you know, you can see the signs of withdrawal. So then I would speak to her and say, look, this is what's happening to you. So now we're going to go back, you're going to take it again, but now instead of doing it every day, we're going to do like, you know, 5 days, yes, 1 day no. And we do that for 2. So I did that plan for like 6 or 7 months. Well, it failed with her. It worked with so many other kids. It failed with her. A year passed, 2 years, 3 years. And I think by the 3rd year, it's very hard sometimes to get kids to talk, right? So, but I normally am not, I try to be their friends, and I try to also protect them. And I only say to the parents what I think, you know, if they're in any danger, I will talk to the parents, because sometimes the parents, when they get upset, they'll go back and tell them, and then they'll lose my trust, right? So I prefer for them to have somebody they can trust, right? So as long as they're not in trouble. But one day when I was, you know, I was like an hour with her, I said, we really need to talk and see, you know, why is it that you can't, like, what is it? She got into a fight, and she disclosed, finally, she was older, and she felt that she can talk, that nothing was going to happen to her, but she told me that her mother was the one giving her the drugs. So it was very hard for me to help her, right, because her mother was the one giving her drugs. So going back to the youth, so I had a lot of those cases, and I realized that when you let them talk and let them express themselves, they will come up with the solutions even themselves later on. So we created this group where they were here in person in the foundation, and now it's virtually, and we just let them talk.
So we hear that you're partnering with BronxNet TV to bring a youth show here. Can you tell us a little bit about your hopes and goals for this youth health show on BronxNet TV?
My goal would just be really to educate our youth on different topics, kind of more health related and mental health related issues, is what I envision on doing with this program. But also make sure that they have a voice is what I want to kind of concentrate on. Working with the youth, bringing them to the programs, and sort of like just be that silent leader and helping them develop what they would want to develop. So as I said, I like them to talk a lot. I like to listen to what they express and what the issues are. I don't like to lead the questions for them, because it's maybe it's a topic that's too sensitive, but things will come out later on, because themselves they will talk about it, and you can see and you can hear, you know, who wants to say what, who doesn't want to say what, because you don't want to isolate, you don't want them to leave, right? You want to bring more kids, and if they feel they're safe, they'll stay, and they'll bring other friends. So I want to create a safe environment for youth, that they can express how they feel, and they can have opinions, and So, and if I can help them with people that I know with medical knowledge I have, and I can help them, I would definitely use that program for that. And also, for me, it's important, as I said, the education, health, but also just make sure that they can learn about different careers, learn about different, you don't just have to go to college. Like, if you can't go to college, it's okay. We can find another path. There's so many things you can do, just amazing things that you can do, that I would love to, explore and show to our teens. That way, just to get their interest and help them out. So I think that would be our goal in our program.
Now for our last question, do you have important information, advice, tips, or a special message for youth and families during this time?
I think the most important thing is that we have to take care of ourselves and take care of the people that are around us. Sometimes, so the youth, they're very healthy and nothing happens to them, but they have to think about who's around them, their parents, their grandparents of their friends. So I would say to all of us, not only to the youth, that even though summer is coming, we're going to go outside, we miss the outside, we miss the parties, we miss hanging out with friends, we miss the sports, to just take all the precautions that have led us to where we are right now. Right? So make sure everybody remembers to put their mask. I know they're very difficult, but you know what? I use them almost 24/7 when I'm in the hospital, right? So just make sure they have their mask on all the time, and just keep your distance. Not to forget that. I know we can get into all that's going on right now, and we can forget, and we want to, go out and everything, but just to remember to please keep your distance, and that all of this happened for a reason, and we need to think in ourselves inside, why is this happening? I believe in God. I believe there's always something happens for a reason. God knows why he's doing these things, and maybe he's making us have a pause so we can look inside ourselves and see what we need to change. Why is he putting us together as a family again? Why is he making us parents teach our kids again? We should think about that. We should think about being grateful for everything we have. Now we realize that even just having a toilet paper, right, when we couldn't get toilet paper. So just be grateful for what you have, and take this time to evaluate inside yourself, see what's going on around you, and appreciate every single person you have. Say thank you. Bring again what we used to do before, right? We forgot to say thank you. We forgot to, have somebody, old person sit and you stand up, things like that. So there was a reason that God did this. We were going too fast. We were not caring for others. We were only thinking about ourselves. And now, God gave us a lesson, so we should learn from this lesson and love each other.
Thank you, Dr. Nunez, for all the work you do in our communities and our families. It has been great talking with you, and we can't wait for the new youth health show to come on BronxNet TV. Thank you guys for tuning in, and I'll catch you next time on the next Open 2.0. Bye.